Hi, I'm Barb, the Total Joint Coordinator at St. Bernard's, and we are going to go over class today because you are not able to attend in person. So we like to start out as introducing our Total Joint Advantage program as it is a wellness-based program. This just means that you come in for surgery not because you're dealing with an acute illness and having surgery as a curative measure, but that you're coming in because you have a debilitating pain that you're dealing with in your day-to-day life. So we hope that you're able to get your hip or knee replacement and go on to be more active and live an overall healthier lifestyle. This also means that when you come in, you're a well patient. You're not battling any underlying acute illnesses such as the flu or pneumonia, and your chronic illnesses such as diabetes and high blood pressure, those are well controlled. This is the case because when you're not battling other issues, you go on to rehab better and get the full benefits of having a knee or hip replacement. We do an interdisciplinary approach to your care, and what that means is, in addition to myself, we have a team of physical and occupational therapists that will be working with you. Their role is to evaluate your safety, your functionability at home, to help assess the needs for adaptive equipment, what type of therapy you'll need following discharge from the hospital, and they communicate those needs to our social work case manager group. They act as your discharge planners, so they will be setting up those needs. We have a very skilled team of orthopedic nurses that will be caring for you while you're in the hospital. We have a few nurses that have been with us for more than 25 years caring for the patient after hip or knee replacement, so they're very skilled and very knowledgeable. Of course, your orthopedic surgeon is very involved in your care. They kind of are captain of the ship per se, and then if we do have a development of an acute medical illness, we will have a medical doctor see you while you're in the hospital as well. We have previously mentioned that we are a wellness-based program, so we ask that you bring your own clothes and own shoes from home. Part of your initial assessment with physical and occupational therapy is getting dressed. They like to get you in your own clothes to make sure that you can do that without the assistance of assistive devices that you will see later on. Plus, we like to get you out of the hospital gown in your own clothes because we don't want to promote the sick patient. We get you up in the chair for most of the day, get you disconnected from the IV pole, and it's our goal for all of our patients to go home with outpatient physical therapy. We see the best results with that. Patients have to get up and shower, dress, physically leave the home. Plus, going to the outpatient setting allows you access to all of the equipment you need to fully rehab yourself after surgery. Pain management is something we work very hard on. We try our very best to keep your pain at a 3 to 4 level. Unfortunately, you're not going to be pain-free following surgery, but we do try to keep it tolerable for you. We use a number of methods. Of course, it starts with anesthesia. Most of our physicians are also using a block that allows us to use less narcotic pain medicine following surgery and allows you a little prolonged relief that way. We have scheduled medicines that you will get. Those are your Tylenol, non-steroidal anti-inflammatory medicines, again, just to help decrease the use of narcotic pain medicine. Narcotic pain medicine is very useful, but has the side effects of sleepiness, nausea, so if we can cut back on their use, we typically see better results with you getting up and getting around with therapy. And of course, the more you move, the better you feel. All of our rooms come with a communication board. This board is mostly just a reference for you with your nurse and patient care tech contact information. It typically has your plan of care for the day, when your next pain medicine is due if needed, and it's just a nice reference. So one of the biggest risk factors following total joint replacement surgery are deep vein thrombosis or blood clots. Surgery in general increases your risk for blood clots. When you operate specifically on the bone, it increases that risk even more. Immobility allows your blood to slow, which allows the blood to pool and clots to form. So we have found that it's much easier to prevent that than to treat it afterwards. So again, we get you up and get you moving. All of our patients have some sort of anti-embolytic device, whether it's on your feet or just your lower leg. That helps increase circulation in your legs. We also have you do ankle pumping exercises, and then your physician will send you home on some sort of a blood thinner. We also work hard to prevent pneumonia. Surgery, of course, increases all of our risk for pneumonia. Immobility specifically allows fluid to collect in our lungs, which increases your risk for getting pneumonia after surgery. We don't see a lot of cases of pneumonia because our total joint replacement population of patients are getting up and getting around so soon after surgery. But the risk is still there. So all of our patients get an incentive spirometer. This is a device that you will do your deep breathing exercises with. We also get you up in the chair. If you think about it, we all breathe better when we're upright as opposed to lying in bed. And again, we do get you up and get you moving. Part of your testing at pre-admission testing will be a complete blood count. That is checking for many things, but one of those being your red blood cell count. With all surgeries, there's some blood loss, and we like to make sure you're at a safe level prior to surgery. If that number comes back low and your physician is concerned about that, we have an alternative to blood transfusions, and that's an infusion of IV iron. The IV iron allows your body to regenerate those red blood cells on its own as opposed to having to take a transfusion. Knee swelling is common and expected following total knee surgery. It's our body's natural defense mechanism to send white blood cells to that area to try to heal the incision, and when that happens, redness and swelling occurs. So all of our patients go home with a cryo cuff or ice pack for their knee. We send you home with 6 gel inserts so that you can have that knee iced pretty much all the time at first, and then pretty often until you heal completely. Lastly, I'll talk a little bit about infection prevention. Another test you will be getting at pre-admission testing is a nasal swab, specifically checking for MRSA, or methicillin-resistant staph, which is known in the community as the bad staph. All humans have staph naturally on their skin, and it's not harmful when it's on the outside of our body. However, if you are positive for this specific staph, you run the risk of that getting inside the body when they do your operation. If that happens, your implant can get infected, your bloodstream, and we have found it much easier to identify that infection prior to surgery, treat it, and then you go on to have surgery like normal with a decreased risk of contracting that infection. We all know that hand washing is the #1 way that any of us can prevent infection. The staff at the hospital utilize foam stations that you'll see all over the place. We will have you have a cleanse shower twice prior to your surgery. This soap will be provided to you at pre-admission testing as well. You should use it the night before and the morning prior to your surgery. This is a surgical soap, so it kills most of the bacteria on your skin. We also treat all of our patients preventatively with IV antibiotics. That's done within a 24-hour period, so it's done in the hospital unless you're one of the patients who go home day of surgery. Dressing changes vary a little based on who your physician is, but that's something we will review with all of you individually prior to discharge. Most of our physicians are using dressings that allow you to shower right away. We don't allow you to submerge your incision, such as in a tub bath or a pool, until your staples are removed or until your physician clears you, simply because stationary water can grow bacteria and you can get an infection that way.
I'm going to talk to you a little bit about what's going on in the knee joint that has brought you here for surgery. You can see in the slide where there's good cartilage or padding in the knee, but where the two bones meet, there's no cartilage, no cushion, no padding. So what we're going to need to do is put in the components to help give you the movement again and the padding in the joint. You can see here, this is the thigh bone, the shin bone. What we're going to do is basically cut off the rough, worn bone in the joint and make cuts that fit the implant that the doctor has chosen for you. These are cemented in the shin bone, a little bit bigger component. And what's on top of the tibial component is a plastic type piece made of polyethylene. This is what's going to act as the cartilage again in the joint. So you can see you'll have that smooth movement again that you've been missing because of the cushion of the plastic component. Now there's not a kneecap on this model. The kneecap, they don't have to cut the tendon. It's just displaced to the side. And a lot of times the cartilage is worn away on the back of your kneecap as well. They'll put some of this same plastic type component on the back of the kneecap so the kneecap slides easily over the joint. Now, if anyone is a candidate for a partial knee replacement, basically what you're going to get is half the implant. You'll still have a piece in the thigh bone and a piece in the shin bone, but it'll only be half of the implant. Typically, I can't say you'll have any less discomfort, but usually your range of motion comes back a little easier during your rehab. For the continuous passive motion machine, the CPM, we still have a couple of doctors that use the CPM. Not all of the doctors will send you home with a CPM machine. Dr. Ball and Dr. Swim still send patients home with a CPM machine. Basically what the machine does, it just slowly bends up and back down. Just another tool to aid in your range of motion. Now we're going to look at the hip joint. With the hip, it's kind of the same thing is happening. The wearing away of cartilage, they're in the socket and on the ball of the hip joint. Unfortunately though, with the wearing away of the cartilage, the bone also starts to deteriorate. So with the hip replacement, we're going to have to give you a new head of the femur bone, a new ball. It's attached to a stem that'll insert down into the femur bone. In the pelvis, a socket will be placed. This model doesn't have it, but you can see on the slide there is a plastic component that is inserted in the socket, similar to that you just saw in the knee replacement. With the hip, it has to be dislocated to put in the new implant. So with that, we have to follow some precautions for about 6 to 8 weeks to protect your hip and to allow healing so the hip doesn't dislocate. Our doctors do two types of approaches, a posterior and an anterior. All that means is are they going more towards the front or more towards the back for the hip replacement. When you come in for surgery, we'll know exactly what type you've had and can show you the precautions that you will follow. But with the precautions, it's things like not crossing your legs. We may not want you to kick back or bend past a 90-degree angle. And also, we wouldn't want you to excessively turn the hip out or bring the hip in. But like I say, you won't follow all the precautions. It'll just depend if you had the posterior or the anterior approach. With the posterior approach, it's pretty much a necessity to need some adaptive equipment that you can see on the screen. With the anterior and with the knee replacement, it's more of a comfort measure. So we like to show you the equipment today. They can be found at any medical supply in town. The kit runs around $30, and anytime you go into medical supply, if you ask for a hip kit, they'll know what you're talking about. But like I say, some of our knee patients need it as well, just to make it easier to do your dressing at home. We will practice with you in hospital on your dressing with our occupational therapy staff to see if you actually need the equipment. Unfortunately, insurance doesn't cover this equipment, so we hate for you to buy it unless it's something you really need. My favorite piece is the reacher. I recommend this to about anybody. And if you're just needing one piece, you may want to go out and buy them. You can find reachers as cheap as $6 at places in town or everybody's favorite Amazon. But with the reacher, kind of the nice thing, if you drop something, you can pick it up. You can use the reacher to take off socks, to pull up pants. So the reacher can come in handy quite a bit. Also in the kit is a shoehorn, a dressing stick, a long handled sponge, and the other piece that people really like is the sock aid. So what you can do, you can take your sock and put it on the sock aid, and then we'll have you sitting in the chair, sit, and you can pull your sock on so you don't have to bend over and protect that, so you can protect that hip. Like I say, we'll practice in hospital to see if you need this equipment. A lot of patients are able to do their dressing after the surgery without difficulty. So occupational therapy will work a lot on those dressing tasks, but also they'll work with you on learning how to get in and out of your tub, or if you have a walk-in shower. If you have a walk-in shower, that makes life just a little bit easier because there's just a small lip for you to step over. But a lot of people have tub shower combos. Now you can see on the slide that the person is using a tub bench. We used to use those a lot, and we still do, but many patients are able to step over the tub and stand without a seat. So we will practice that to see what best fits your needs. Now we'll talk a little bit more of what to expect with the rehab while you're in hospital. Know that we will plan on seeing you physical and occupational therapy on the same day as your surgery. We will come to your room together, PT and OT, and our main goals is let you start moving that new hip or knee, doing some exercises. We'll help you get up to the edge of the bed. OT will work with you on your dressing, so they can show you some tricks and we kind of know if you might need the equipment. And then we'll try to get up and walk a little bit. Most of the time, unless the medicines have made you kind of drowsy, people are walking down the hall. So it's pretty amazing. Then when you get back, we can let you sit up in the chair for a while. Early mobility is key to help with pain control and to prevent other complications that Barb mentioned earlier in the presentation. On the next morning, we will bring you down to our rehab gym. We'll go through exercises that you will be doing at home and also the ones you'll do at your outpatient therapy appointments, but we want to make sure you're keeping up exercise every day after your hip or knee replacement. We will also practice with you going up and down stairs because most people have stairs at home or in the community. We want to make sure you can do that safely. We also have a car in our gym for you to practice getting in and out of. Those patients with hip replacement, we have to make sure we're keeping those precautions. So we'll instruct you so we can protect that hip. With knees, it's more of a comfort measure. You may be limited in your bending, so we will want to show you how to comfortably get in and out of your vehicle. Now you can see the lady on the slide. You can see she's dressed in just a t-shirt, shorts. We want you to just come in something comfortable so you can move around. You're not attached to a lot of equipment, so it's easy to practice all these skills that you need for when you get home. And the big thing I like is the big smile on her face. We can't promise that you'll be smiling the entire time that you're with us, but the big thing why I say that is that if you come in with a positive attitude, you're probably going to have a great result. She wanted to get back to traveling with her family, so that's what I want you to think about. What is your goal? What are you wanting to get back to? Are you wanting to get back to gardening, being able to travel, play with grandchildren? Or is it simply you want to be able to walk into a store and get a gallon of milk without being in terrible pain? That's what I want you to keep in mind, because you'll have your good days and your bad days with the rehab, but the key is the consistency, attending your outpatient therapy and doing your exercises at home, and getting up and walking and being mobile to get you back to doing the things you've been missing out on. Now we're going to look at the exercises that are in your book that you were provided. On page 36 or 37, it kind of depends if it's the hip or knee book, you'll see the exercises listed. We have a picture and a good description of each exercise. We want you to try to do these exercises at least twice a day. It's kind of good to do it in the morning and then in the afternoon, so you're doing exercise throughout the day. You can see there it shows you to do it on a hard surface, but you can do it on the bed, couch, chair, wherever it's comfortable for you. We always joke you probably don't want to get in the floor because it may be hard to get back up, but just wherever it's comfortable for you, start going through these exercises. It's going to get you and your muscles in the habit of doing them, so you'll be ready when it's time to come in for your joint replacement. You'll also see there's some upper body exercises. You're going to be using your arms quite a bit to push through the walker, to push up from a chair or the bed. So we want you to have your upper body ready to support you with that. If you have some weights at home, great. If not, just get some bottles of water or cans of soup. You can use those as your weights and work through the upper body exercises you see there in the book.
I would like to take a minute just to tell you a little bit about My Mobility. My Mobility is a program that most of our physicians are participating in, which allows you patients to download an app onto your phone. It's compatible with both Apple and Android devices. With this app, you are sent a specialized exercise regimen for before surgery as well as after. With the app, it also sends you a detailed video of how to do the exercise. We're able to track your movement. My favorite part of the app is you're able to send messages to your physician and myself if you have questions or concerns. We have people send us snapshots of their incision if they're concerned about that, just as an example of one thing you would want to communicate to your physician. The best part of it is absolutely free for patients. It's also optional, but if you feel like that is something you're interested in, you can email or call the number at the bottom of the screen and we will get you enrolled in that as well.